Dr. Anthony Cave here to talk about the most outrageous case of medical fraud that I have seen in a while. And here is the video
Hey
to back up
there,
the
are you
arrest.
Autumn?
Yeah,
Can you step out of the car for me, please?
sure.
Turn around, put your hand on your...
This lady is Autumn. She is 29 and she is on count for 4,400 patients she's fraudulently treated, but they can only charge for 7 counts because how could you possibly not bog up the whole legal system if you try to go for 4,400 counts? In the most ironic set of events over about 7 months, led to the culmination of her being arrested here,
Okay, my child's across the
still wearing
Okay,
scrubs.
alright.
Am I being arrested?
You are.
Yeah, please,
Hold on,
Okay.
hold
Can
on.
I ask? What can I?
We have plenty of time to talk.
Okay.
Just give us just a minute.
Can I see my car?
Yeah, we'll take care of all that.
Can I tell my boss so I can tell her I can't go to the?
You have any other weapons?
Juliet 34 flag.
How did the system go wrong here? Well, I'm going to end with a question for you. Please stick around until the end so you can tell me about your thoughts on how this could slip through so many cracks, starting with Autumn graduating from university in 22 and failing her regulatory exam to become a nurse in Florida, being hired in 2023 by Advent Health as an advanced nurse tech to be supervised under an RN, but along the way being required to take that test and pass it, but she actually never showed up to take the test from what we heard from the sheriff's office. Instead, she pulled an identity theft and took the RN licensing number of another nurse who had the same first name but a different last name, claiming that she was recently wed. Here is the crazy part. She actually went to college with this same individual, apparently didn't know her, and that same individual also worked in the Advent Health system. Things went hunky-dory for about 7 months until she was apparently so good at her job that she was up for promotion to be a charge nurse. Boggles the mind how someone who doesn't even have any regulatory certification to do this job is being promoted. And when she was up for promotion, this is maybe the funniest part, this sparked interest in some of her colleagues. I don't know if I can read between the lines there any better than you. It sounds like maybe some people were jealous and actually looked up her details and notified the supervisor that, hey, her stolen, well, they didn't know it was stolen at the time, I guess, but her identity was expired. Her licensing number was expired because I'm guessing the original Autumn didn't renew it, the one whose identity she had stolen. This led to her getting fired, as you could imagine. And the crazy part is that at the end of all this, she went on to take the test about 6 weeks after getting fired and finally passed it and was working as a traveling RN when we see her get arrested here in the video here, wearing scrubs at the very end. So she went through all of those months of treating over 4,400 patients fraudulently, practicing medicine without a license just to take the exam in the end. Amazingly, no one was harmed. And my question for you at the end of this is, clearly medicine needs to take care of lots of people, but when you have such a big bureaucracy that can allow such egregious misses to fall through the cracks for so long, do you think we should go back to the days of just having your corner doctor's office or your family doctor who you know and trust and personally know versus having these behemoth medical corporations in charge of our health where there's so many kind of hidden administrators or hidden supervisors or folks who don't actually take care of the patients dictating who cares for patients? Maybe it's a philosophical question here, but I really wonder what you guys think about how this could have happened and what medicine could look like if maybe we didn't have such a large corporate medical structure here in the United States. I'm so curious to see what you guys think here. Hey, if you learned something new about this story, please hit that like button to keep up with all of my content, learning ways to advocate for yourself. And I want to go through some of your comments here. Kaylin, I agree, she must have been desperate, but certainly putting 4,400+ patients in harm's way is not an appropriate way. I know you're not suggesting that, of playing out maybe a fantasy or a desperation of being a nurse. Elle, I kind of agree with you. Small systems, I think, in some ways can work better when there is more trust between the doctor and the nurse and the patients. In my personal medical practice, all of our patients know our nurse, all of our patients know me, all of my patients know our other doctors. It's very much, I feel, more conducive to healing and trust. Chris says personal experience screams bureaucracy. I hear you as well, because we need to have large systems take care of large groups of people. And honestly, if you just did the right thing and got licensed, we wouldn't have had any of this issue in the first place. Traveling medical personnel. Nick, I kind of wonder the same thing as you. Does everyone here know what traveling medical personnel are like? Traveling nurses, traveling doctors, etc. It's filling a need that has to be met, but you wonder if you're not filling it with maybe some of the folks who aren't staying in a particular system for a reason, if you know what I mean. Champion's path. Experienced nurses should be better. I would hope that experience buys better outcomes. Remember, experience is the most bitter way of learning something new. Hopefully one learns something to prevent mistakes from happening, because learning by experience is expensive. We want folks with experience. We also want people who have gone through the learning process to hopefully prevent mistakes from being made to learn through that experience. Not only a separation for working, but also a desperation for help. Well, yeah, Jody. So yeah, desperation for working and for help. I agree. I've just joined the psych field as a psych nurse, especially if it feels like it's just there as an administration stopgap. Patients are kind, but not treated like prisoners. Oh, yeah. I hear you. So I work, as you know, in my clinic with many folks struggling with physical pain or emotional pain, and hearing their experiences coming from more of the bureaucratic medical practice, Jake, I hear you loud and clear. And it breaks my heart to hear their stories. It's very gratifying to see how their care can transform in a very short period of time when they're treated like people and not like, primitive prisoners, in your words. Caring, go back to family doctor. Medicine is not as it was my day long ago. Very few private practice any longer. Yeah, I hear you. How often do folks not even know who their primary care doctor is because it's just some individual in a large medical corporation? I just don't know how conducive that is to the healing that many of my patients are seeking. If you're not licensed because you didn't take or pass the exam, it means that you're still a student, and there's a way to proceed. I agree. Choosy, got a long username here, but certainly you shouldn't be putting thousands of patients at risk while you're still learning. I feel safer with smaller local organizations. MW, so curious. I tend to agree in some ways. I'm not saying they're immune to problems, but it's so helpful to hear your guys' perspective. Kunsal, what do you think? Should we go back to knowing your family doctor or the big behemoth medical corporations? I have a doctor who I've seen for 40 years. He never jumped from private practice. He still visits elderly at their homes. Wow. Lori, well, that's a wonderful story to hear. I hope that he never retires. Well, at least not anytime soon. My niece is a traveling nurse. She likes the 3 months summer gap she gets in return. There's good aspects to many different ways of practicing. My question is, what do you think patients best appreciate? If she sent to med school to be an RN, shouldn't be shown hands-on training to care for patients in the first place, no matter. Yeah, well, I agree. I would not trust this individual either. Oh, here's an interesting answer. Let me answer that. Ego, stupidity of those who think that because they are licensed and or legitimate on paper, no one else has the capability to answer or execute that knowledge. I have to disagree a little bit here. I don't think it's ego. I think it is demonstrating a degree of training to safely take care of vulnerable patients or putting their trust in your hands. So I can appreciate the frustration. I can also appreciate that there is a need, as I'm sure many of you will appreciate, to demonstrate competence consistently when you are being paid to do so and entrusting. So I agree, wrong, as Susan says. Until next time, remember that you have more power over your health than you've ever been told, and I hope that you feel comfortable speaking up for yourself and asking your doctors or nurses for any questions about their licensing so that you don't fall victim to someone who's fraudulently practicing without the right training or the right certification or the right adherence to whatever the local laws are to make sure that patients are safe.